Welcome back. Well, among many fine departments that are at Hoag, the Department of Radiology has certainly over the years, not only has it grown, but the technology that's been involved is just incredible compared to probably what it was just 20 years ago, even 10 years ago. We have Dr. William Van Dalsem on today. He is the Chief of Service of the Department of Radiology. Nice to have you here.
Thank you very much for having me.
What does the imaging, the Hoag imaging encompass? Tell me about the department in general.
Well, Hoag Imaging provides basically all radiology services available. That encompasses or runs the gamut from simple x-rays, chest x-rays, bone x-rays, all the way up to the most advanced imaging modalities such as MRI and 3D digital tomosynthesis of the breast, and everything in between, CT, ultrasound, nuclear medicine. And with each of those imaging types, we use the most advanced techniques out there, sometimes only available at academic or university settings. All of our equipment, like you mentioned, is state-of-the-art. And our radiologists, which I think really sets us apart, our radiologists are the ones that actually read the x-rays or read and interpret the imaging studies, are all fellowship trained beyond their diagnostic radiology and a subspecialty of radiology. So that allows us to subspecialize and read specific imaging types of examinations more precisely. So all that together allows us to provide to our patients and our referring physicians the best images and the best interpretations possible.
Do all your, Hoag has several locations, do they all have the same imaging services, or it just depends?
It kind of depends. Our Hoag health centers such as Huntington Beach, Aliso Viejo, Newport Beach, all have CT, MRI, ultrasound, diagnostic, and some interventional procedures in certain places. Some other places, such as our breast center and at Woodbridge in Irvine and Huntington Beach, have full-blown breast centers with a dedicated breast radiologist, and they do breast procedures and all breast MRI and all of those things. We also have an imaging center in Fashion Island, Newport Imaging Center, that provides MRI and CT. And then within the year, in Irvine, right across the street from Hoag Hospital, Irvine, there'll be a brand new Hoag Health Center, Irvine, that is going to be state-of-the-art cancer center and a full-blown imaging center with a 3 Tesla MRI, brand new CT scanner, PET CT, a full mammography breast imaging center, ultrasound, and nuclear medicine.
So you're really expanding.
We are. We are all over Huntington Beach down to Aliso Viejo.
Yeah, Aliso Viejo. Is that a fairly new location, or are you expanding that one?
No, actually, it's been around for a while, but we just remodeled that whole center and the imaging center itself. So we have a brand new MRI, a new CT scanner. We also offer ultrasound, digital screening mammography, DEXA, and X-ray.
Wow. So tell me about PET MR. What is, we've heard of PET scans and things like that, but kind of explain that.
Well, we're really excited because PET MRI is a brand new cutting edge technology that utilizes what's called hybrid imaging. So hybrid imaging is where you take 2 different imaging modalities and put them together into one machine. In this case, PET, or positron emission tomography, which utilizes an injected radiopharmaceutical that is then images and measures the function of cells and tissues. The problem with PET is that it has low anatomic detail. It's poor resolution of body parts. And then it takes MRI, which on the other hand has really highly detailed anatomic imaging capabilities of the soft tissues and bone marrow. So you take these 2 imaging types, function and anatomy, and put them together in one machine. So in one sitting I should say, the patient gets the PET and the MRI simultaneously. And by doing that, it allows the images to be co-registered and then fused together into one picture.
Nice.
By doing that, it produces a synergy that allows us to get more information about the patient than either imaging modality could alone. So it's a brand new technology.
Now, when would a patient be right for that type of technology?
Well, first and foremost, it'll be in cancer patients. Certain cancer types will be well suited for PET MRI, such as head and neck cancer, certain pelvic malignancies, sarcomas, and brain tumors. And then in addition to that, with cancer treatment follow-up imaging to see how treatment's going, or in difficult treatment decision-making processes, the PET MRI may really be beneficial.
Okay.
And then in addition to oncology or cancer, in the field of neurology, there'll be a lot of work done in the workup of dementia and Alzheimer's, as well as, and as well as seizure workup and treatment planning. And then what's really coming around, a lot of press lately, is head trauma. We think that head trauma will have a place with PET MRI as well.
Will it allow you, with those kind of dual technologies, when it comes to head trauma, to be able to really kind of map out and see maybe exactly what happened, or possibly?
We hope so.
Okay.
This is so cutting edge that we're still investigating a lot of stuff, and the universities. You know, our machine, which will be up and running in the next month up at Hoag, Newport Beach, will be the first clinical MRI scanner on the West Coast. The only other PET MRI scanners are all at academic institutions, and they're research only. So they're working on a lot of those questions, but ours will be out and actually clinically available in the right setting for patients.
Very nice. Yeah. Now, what's the difference of MRI or PET MRI and CT?
PET MRI versus PET CT, well, first of all, they're both hybrid imaging. The difference is the MRI versus the CT. And as I mentioned, MRI has really highly detailed anatomic capabilities for soft tissues and bone marrow, much more so than CT. So it lends itself to certain cancer types or certain body parts, such as the brain, head and neck, the pelvis, that type of thing. So that's, we think, where it's going to show benefit. In addition, MRI doesn't utilize ionizing radiation to produce its images versus CT, which does. So you can save the equivalent of up to 100 to 150 chest x-rays radiation exposure per examination by doing a PET MRI versus a PET CT. So this is really applicable for patients who have to have repeat PET MRIs, or younger patients, and particularly the pediatric population. We think there's going to be a real use, unfortunately, for kids who get cancers or have problems that we have to work up. So we think there'll be a real role for it there as well.
You know, you brought up an interesting topic there when you talked about the x-rays, and I think over the years people ask about that, and I think rightly so. If they're going in for, like you said, it might take 100 x-rays over time. What are going to be the effects of those? Are the effects minimized compared to what they were years ago? I think it's a common worry for people.
There's a lot of debate out there about, there's never been a study to prove that medical imaging radiation causes cancer. Obviously, all the data is related to Hiroshima and Nagasaki and the atomic
You hear that
bombs.
word, radiation.
Radiation. Yeah. So the best rule is that at best it doesn't hurt you too much, but at worst it could hurt you. So you want to minimize the amount of radiation you have. So you have to balance that. We always say, the benefit of what the study will tell you versus not doing it and not knowing. So the best is to allow your doctors to make that decision in conjunction with the patient and decide. But we do everything we can to reduce radiation. Over the last 2 or 3 years, a big project of mine in our department has been to go to all of our CT scanners, which we have about 15 or 20, and make sure that every study we do and the protocol we use minimizes the amount of radiation. And we're part of a national registry that reports to the American College of Radiology, and we track our radiation dose to make sure that we minimize the risk to the patients.
Very good. Are there certain techniques that you would use, or certain equipment where there's less exposure because they're newer, or do they use a different type of X-ray, for lack of a better term?
Plain X-rays are always less radiation than a CT scan.
Okay, plain meaning like, say you broke your arm.
I should say, X-ray of the hands,
or your teeth, or something.
Yeah, exactly. Like that. That's a lot less radiation than a CT scanner, or an angiogram. If someone's undergoing an angiography, those things have more radiation. But with every type, we minimize the amount of radiation needed to do the study to allow us to produce a quality study.
And as you said, the amount of information that you gain from those is just, you can't get it any other way, right?
No, I mean, it's in the last 30 years with
amazing.
CT and MRI, it's changed how people practice medicine.
How long, it was about 30 years ago, is that when MRIs came out?
MRI was, the early 80s was
Okay.
the blooming of it with brain MRI, and then it moved to, for orthopedics, for joints, we really, and then it moved on to the other body parts.
Okay, what does that stand for, MRI?
Magnetic resonance imaging.
Okay, now do they still use, obviously I know they still use it, but you have those big machines that you kind of slide into. Are there more portable ones now, or depending what your need is?
There are a few of the more portable ones, but they don't, unless it's, an emergency situation, as most people know, they're fixed in sight.
Okay.
Because they've made them wider, what we call the bore, the hole that you get put into for claustrophobic people. The standards kind of gone to a bigger, larger bore, so people have less problems with claustrophobia. But for the most part, the good MRI machines are at either 1.5 or 3 Tesla, meaning the strength of the magnet. Anything lower doesn't; those have kind of fallen out of the way, and they should be fixed in sight.
And the reason that they're round is it's spinning inside of there? Is that basically so it can get a full, like a 3D type?
Well, there's a big magnet.
Right.
The superconducting magnet is around it, and it has to be all the way around it. And then there are what are called gradients inside, which send radio frequency pulses to, it basically images the hydrogen atoms in your body.
Yeah.
And it puts them all in one direction. And then depending on what surrounding tissues there are, I'm going to get myself into trouble because someone's going to hear this.
Yeah, but it's interesting.
Who knows more than I do?
Yeah,
They'll say
it's interesting.
but yeah, it involves that. So it's that's why it has to be round, because the magnet is surrounding you.
Yeah, interesting. You always see that, you watch some of those medical shows and they always show those. And so I was always kind of wondering how they work. So I thank you for that information. I want to mention that you can go online to hoag.org/pet, P-E-T, just like a pet, and you can get information there. Also, their number, their main number is 1-800-400-HOAG, so you can call there. Sounds like just a department that is just expanding technology-wise and getting better, and it's going to be interesting to see where these new technologies take us. It's only going to make it. You're going to be able to really pinpoint things, I imagine, a lot easier and a lot quicker, hopefully.
We think so, and we're excited about it too. It's a fun place to work.
All right. Nice to meet you.
Nice to meet you. Thank you very much.
All right. Thank you. We'll be right back.